Hey everybody, Dr. Rob here. Friday, day 8, health update today. Sitting outside again, can't get enough of this beautiful weather. Really adapting to the, pseudo-isolation, if you will. Trying to do my part, keep everybody healthy. Really can hardly wait to get back to the office, start helping people in an in-person light. I have a feeling that, some things will start to turn around. We'll be able to do that. Again, anybody who needs me, here you are. Social media is great. We're doing telemedicine. We're doing nutritional consults. A lot of insurances cover it. But more than that, what I wanted to get into today was, and I want you to put in your comment box, a lot of you emailed me questions because you've seen a lot of questions and answers, not just on COVID-19, but in health in general. Health is at the tip of everybody's tongue now. Having said that, any questions that you have, put in the comment box and I will answer them today. These are emailed in questions in the last week. Questions that I thought that were pretty good. So we're seeing a lot of people on the front line, healthcare people. Does a protective mask help people? So we're seeing them in the, not just in the front line, healthcare providers, but we're seeing people with protective masks wear them in shopping centers, not centers, but places to shop. The answer to the question is yes. The protective mask works. Here's how. There was a study that was done in Singapore that there were 41 medical doctors that were aerosoled from positive coronavirus patients. 35 of them had regular masks. 6 had the NK95, the real thick mask. All of them did not catch the coronavirus. I'm not saying you're not going to get it if you're wearing a mask. This is not medical. All I'm saying is it is appearing to be in the literature quite protective. So if you're a little concerned and you can get a mask, wear it. Please don't take the masks of those in the hospitals and EMS and things of that nature. The other question, another one is, how common is the loss of sense of smell with COVID-19? 30%. About 30% of people lose their sense of smell. And they lose their sense of smell also with the flu. What happens is it's respiratory and there's inflammation. And the inflammation can affect one of your nerves or cranial nerves called the olfactory nerve. And by inflaming that nerve, you have a tendency to lose your sense of smell. The person followed up by saying, what does it mean? Well, it's very interesting. Most people who have a loss of sense of smell with the flu also have a sense of taste. That loss of sense of taste and smell implies there's damage to what we call your central nervous system. So people think that a flu is just upper respiratory, but it's your whole body, and that's truly indicated through the idea that you lost your sense of smell, and you, in most instances, will also lose your sense of taste. Can probiotics help with obesity? So like I said, almost every day we're going to see people 50% lighter, 50% heavier. Clearly we don't want anybody to just gouge themselves. But probiotics, yes, there was a few studies just recently in the last 2 weeks that spoke to the idea of probiotics and improving obesity. More so than that, your gut communicates through your whole body. Your gut can communicate with your whole body. Your gut communicates with your whole body via blood, hormones, and what we call your vagus nerve. So the different bacteria, good versus bad bacteria, in your gut actually will speak and allow you to have a decrease in inflammation. So one of the first things that I do when people want to lose weight, other than change their diet, is definitely give them good quality probiotics. Did you have somebody who wrote in?
Mike Powell, essential oils, good, bad, or indifferent.
So essential oils, good, bad, indifferent. Love the essential oils. I think they're very positive. My answer is thumbs up to essential oils, add them. And in the chiropractic light, essential oils, Mike is a great chiropractor out in Oregon. Essential oils have worked really well. We've used them as a transporter via low-level laser. What is muscle memory? So that's an interesting question. Most people think the memory is in the muscle, but muscle memory is actually stored in your central nervous system. So your body has the ability to remember where you were at a certain period of time. And muscle memory refers to somebody who may have been more muscular, but that central nervous system actually, not the muscle, has the memory, and you can get that muscularity back through specific training. Can it help us keep us fit, muscle memory? Absolutely. So the real question, I think what this person wants to know is, I'm at home and I don't have access to weights, so I can't do any weight resistance or as much weight resistance or more than my own body weight. Will I be able to get that extra muscle mass that I'm carrying around back? Yes. So the studies have shown if you stop lifting weights for 12 weeks, you actually within a 12-week period can gain all that muscle back because your central nervous system has muscle memory.
405 nm pulse cool laser.
So to piggyback on what we talked about, so there are two types of, well, as everybody knows, I use low-level laser, non-thermal cold laser. I use them in my office. I use them for health benefits, musculoskeletal outcomes. So there's two wavelengths that I like most, that the literature has really dictated that that's what we should use. 635 is a red light. It's a nanometer light. It mimics, believe it or not, visible light, and it's very positive for musculoskeletal outcomes. Peripheral nerves, those are the nerves outside your central nervous system in your arms and the legs. It's also shown to really be good for muscles, cartilage, and tendons to heal. The one that Dr. Powell's referring to is the 405 nanometer, is a violet light, and there's a cornucopia of good literature on the 405. It's antimicrobial, antiviral, antibacterial, and it also works with one of your nervous systems. So the red and the violet light together actually balance something called your autonomic nervous system. So your autonomic nervous system has a sympathetic and a parasympathetic system. Your sympathetic is fight or flight. Do you ever get scared? Do you ever get an adrenaline rush? Well, that's your sympathetic. Your parasympathetic is your wine and dine. Hey, I'm cool. It's your rest and digest. The 405 nanometer violet light also has been used for a sympathetic input. So as Dr. Powell was referring to, we use them both, and yes, both can help with essential oils. A great choice to build your own musculoskeletal health. Do we have another one, or can I go back? Okay, this is a great one. What is the best home treatment for lower back pain? So essentially, hey, none of the chiropractors are around. Right now, everybody's isolating. My back hurts. What should I do? Well, let me give you some tidbits on that. Number one, no heat. I hope I made that passionate enough. No heat. Heat I don't like. The reason is, even though heat stimulates blood flow, heat stimulates inflammation. And most people who have lower back pain have a form of inflammation. So I am not a heat person. If I had $1 for every time somebody came in and used heat instead of ice, because we recommend ice virtually every time, I think I would be able to take the U.S. deficit down by 50%. It's done all the time. I don't know why it's on the internet. I wish they'd take it off. So you're hearing it. I'm putting the stake in the ground right now. Ice and no heat. Having said that, ice for 15 to 20 minutes in an area, 40 minutes off. Ice is extremely positive because ice will help the person at home manage and modulate inflammation. So I'm an ice proponent. People don't like ice sometimes because, it doesn't feel that good. It's kind of cold. Heat feels really good. Heat actually, I feel good for 30 minutes, and then it gets worse. I can tell you with 21 years of clinical practice, almost to a T, that every time somebody iced it, they inflamed their injured area exponentially. Heat the area. Thank you. I misspoke. Heated the area, inflamed the area exponentially. So really no heat, always ice. And if you have like a cup, like a Dixie cup, and you have the ice in, you want to unwind and tear away the Dixie cup as you run it, move it in the area and rotate it around, another great choice. Just let me know if there's any questions. What is Asparlardi and what are its positives? So people have heard me talk a lot about Asparlardi. Asparlardi is one of my favorite, not the only one, but one of my favorite probiotics. Asparlardi is a yeast. So I like to recommend Asparlardi with many patients who have to take antibiotics. So here's one probiotic that you can take simultaneously with an antibiotic. In addition, its positive effects include, number one, it stimulates growth of good bacteria like Bifidobacterium. Number two, it also decreases the incidence of C. diff. And three, good takeaway, it stimulates something called secretory IgA, which is a critical immunoglobulin to help you clear out inflammation and damage in the gut area. So Asperlardi is literally on almost all of my prescriptions or suggestions for most people taking a probiotic. Is mouthwash healthy? Somebody must have read an article. So mouthwash, which has a lot of alcohol, has shown not to be healthy because the alcohol kills all the good and bad bacteria in your mouth, and there's a direct tie between what goes on in your mouth and what goes on in your gut. So the answer is regular alcoholic mouthwash is not something that I usually recommend. A more natural mouthwash without the alcohols, without the added ingredients and chemicals, is something that I would recommend for everybody to keep in their armamentarium. Go ahead.
Can you speak to IR saunas near versus far and immunity?
Oh, so saunas and immunity. What another great question. I'm sorry?
Infrared, I think.
Infrared saunas. If I had to do it all over again, and guys saw my home gym the other day, I would have added a sauna. And I think the real reason we didn't want to add the sauna was it was a coin flip on who was going to clean it, and I think it was me. Now, I do like the saunas. I think 20 minutes of sauna where you sweat and remove all your toxins is a great choice. So if you have the opportunity to get one, if it can get delivered, if you have one in your house, or if you're thinking about purchasing one in the future, I do recommend infrared saunas. It's great to help detoxification of the body via releasing chemicals through perspiration. Is toothpaste healthy? Well, once again, most toothpastes, no brands that we're mentioning, have something called triclosan. That is a chemical. Those in the study who brushed their teeth with triclosan, a regular toothpaste, had a 75% increase in leaky gut. So we use an organic, natural toothpaste. I take it with me when I travel. So I always tell everybody, start looking at the ingredients that you're using. Most of our household needs or in our household tools have a lot of chemicals that are extremely deleterious to our overall health. What is the cytokine storm? Can't get enough of that. In reference to, love the question, NLRP3 inflammasome. So we've talked about the cytokine storm multiple times. The NLRP3 inflammasome. Everybody knows my new book's coming out, Super Highway to Health. And my editor actually removed a sidebar talking about the NLRP3 inflammasome. Obviously, that got put back in after all this came out. So that is a pathway that stimulates inflammation. So it's a pathway in the gut, in the lung, and these other areas that we're talking about so prominently now in the news that stimulates inflammation. It stimulates something called NF-kappa B, which is the signal transducer of inflammation, and that ultimately, through multiple signals, not trying to get too technical, releases interleukin beta 1 and interleukin 18. And those are the two interleukins that everybody's talking about that is causing the cytokine storm. Excessive release, stimulation of this inflammasome, excessive release of these interleukins lead you down a path of too much inflammation. So a little inflammation is good for you. It fixes us. Too much inflammation damages us. After washing your hands, which is better in a public bathroom? Towel or air dry? It's a really good question also. So after you wash your hands for 20 to 30 seconds, really getting in, opening up the thumb, paper. The air dry have found to have a high number of a multitudes of, believe it or not, fecal matter and large amounts of bacteria, because they're saying that when the air dry hits your hands, it knocks the bacteria up. Some people touch it with their hands, much higher amount of bacteria in the air dry versus wiping your hands with the paper. Or somebody like me right now, I probably would go with wet hands for a little while. I'm not shaking anybody's hand anytime soon. How and why does the gut have 80% of your immune cells? So essentially, it does have 80% of your immune cells. Everybody's heard me say that literally on every live. So we have something called MALT, mucosal associated lymphoid tissue. It's throughout our body. It is our ability to protect ourselves with immune cells. 80% of the immune cells, it's called GALT, gut associated lymphoid tissue, is in our gut. And it's in our gut and it's able to protect us. And it's an interesting thing. Every day we hear so much about the different things going on in a health era, in this health moment. Is this our ethos right now in the idea of, is COVID-19 going to be the ethos for this particular era? That's a good question, but passing on the philosophy, the gut has 80% of our immune cells because it's built that way. So everything, no matter today, tomorrow, or in the future, things we should do to help our gut. Some of the questions I always pose to my patients are very simply, do you have the guts to be healthy? What have you done for your guts lately? So if you want to be healthy and you want to keep your immune system in a pristine condition, do gut promoting things. Does a low carb diet keep your brain young? Well, there are no essential carbohydrates. There are essential fats. There are essential amino acids, so obviously I like protein and fats. On most fats, most proteins, and limited carbs. Carbs like certain fruits, berries, apples, elderberry, and the like are great choices. Diabetes type 3 is called Alzheimer's. Your brain is 60% fat. It needs fat to function. So with that being said, try and limit your carbohydrates and certainly don't eat any refined carbohydrates. Why is ibuprofen so bad? So there is a balance, an argument, two sides to the argument about ibuprofen and COVID-19. I don't like ibuprofen in general, and here's why I don't think people should take it anyway. Very simply, ibuprofen is a non-steroid anti-inflammatory. It does decrease pain, but it's shown to inhibit healing. The most damaging thing that it does is it damages your gut and damages your tight junctions. So ibuprofen shouldn't be taken if you're worrying about immune support and immune enhancing concerns. Why are genes not your destiny? I guess people have been reading some of my blogs. So our genes aren't our destiny, very simply because our gene pool, your gene pool, loads the proverbial gun of life. But your environment actually fires the gun. Now, environment meaning what? Stress, what you eat, your environment around, how you exercise. So again, I've taken different gene tests and I'm not fortunately expressing many of the different genes because I'm trying to keep my lifestyle and environment on a healthy path. Here's a little case question. We have a 51-year-old female and she's tried the ketogenic diet without results. Can you help me? Without question. I've written multiple blogs on the ketogenic diet. I had a 6-month run where I lectured on it, and I'm putting it in my upcoming book, Superhighway to Health. Women did have a tougher time on the ketogenic diet, and it was very perplexing to me because I couldn't understand why. And it always comes back when there's a difference between a man and a woman in the doctor's office. What's different? Well, so there are some structural differences. There's hormonal differences. Women are based obviously more on estrogen. Men are based more on testosterone. So when analyzing the literature and looking at different studies, they found out that the women from 15 to 50, this woman happens to be 51, had a tough time on a ketogenic diet because they had very high estrogen. They only didn't have the higher estrogen because that time of their life it was elevated. Many of these women used either hormone replacement and or birth control pills with prodigiously increased their estrogen. So estrogen posed a problem for women. So women had a tougher time with keto than men. However, I do like the ketogenic diet. Many women like the ketogenic diet. So my suggestion and what I've done in my office is that I do a detoxification, detox 2 pathways in the liver, actually detox estrogen. Estrogen gets detoxed in the liver. So most women, if they're interested in the ketogenic diet, go through a 10 to 15 day detox. We then put them on the ketogenic diet and they get excellent outcomes. In addition, the ketogenic diet, there was a blog that I wrote, it's called The Dirty versus the Clean Keto. People think the keto means you can eat processed food and sausage and bad choices in food. My clean keto is all natural whole foods, avoiding those processed foods and still incorporating no dairy. Dairy is usually high in a typical ketogenic diet. I don't allow people to eat dairy because when they eat dairy, it's very damaging to their gut and inflammatory. So I recommend what we call a clean keto, versus a dirty keto. And the way I keep people into ketosis is usually supplement with something called medium chain triglycerides, which is great brain fuel. I think we have a question.
What about free radical damage, oxidative stress, and immunity?
Free radical damage, oxidative stress, and immunity. Well, let's talk about a couple of ideas. So free radicals will cause oxidative stress, all damaging our immunity. Immunity is at the top of everybody's conversation. What do I do to keep my immunity up? What do I do to boost my immunity? How can I strengthen my immune system? How can I be this healthy, vibrant person? So here's a couple of things. I'm a big proponent of L-glutathione. Glutathione is the master antioxidant. It goes through the NRF2 antioxidant pathway. So anything that you do to stimulate L-glutathione or take it supplementally will help with oxidative stress, or if you will, increase what we want, nitric oxide. Low-level laser has also shown in multiple studies to increase nitric oxide. In addition to that, if you want to increase the NRF2 pathway, exercise is willing to do that. Do we have some more? So feel free. This has been great. Keep the questions rolling in. Like I've told everybody likes to email me and DM me with questions after I'm off the live. We're trying to encourage people to come on to the live, ask the questions, let me answer them, and let me be here for you. We're going to pick it up next Monday. I give you the weekend off. This has been a lot of fun. I always appreciate the questions. I always appreciate trying to share. If you have anything you want me to talk about on Monday, feel free, put it in a comment when you watch it on, if you will, Memorex. Once again, been my pleasure. Dr. Rob, always yours in health.